मैं वहां पे आ
Durga, please go ahead.
Good morning, one and all. It's an extreme pleasure to see all of you in large numbers joining Maharashtra Chapter hosted Annie Empower Hour. It's an honor and privilege to have our Annie National Vice President, Dr. Unmona, here with us. So I request Madam Unmona to say a few words.
Hi, good morning, everyone. It is lovely that Maharashtra Chapter is taking so much initiative and very excited to start the program. And that is, we are coming to the end of the year. You are going to wind up that we have focused on the patient safety and the patient focus it was entire year. Of course, the Karnataka chapter yet to do, that will be continued in the month of January. And after that, it will go to, the next year from the February, actually Kawaljit Madam will take up. We are looking forward what theme we are going to focus, and we may have a different theme, and we'll be having many more exciting events. And I just want to share, as usual, little bit about. Can you see this?
Yes, ma'am.
Okay. So this is the Maharashtra chapter over here. I am not going to introduce the speakers because Maharashtra chapter will introduce. But I just would like to tell you that, yes, many of you are the ANEI member. As usual, every time I'm saying this, the vision of ANEI is to provide leadership, professional development, and research to advance nursing practice, nursing education, and patient care, while contributing effectively towards India's health goals. So that is our vision, to focus education, practice, and patient care so that we can contribute to our nation and to make an impact. Our mission to work with all stakeholders. So we are having the diverse people in even our Empower Hour 2, and in our annual conference, we invite the different people from the different discipline in establishing a national system for improving the nursing scenario across India, thereby impacting patient safety and clinical outcomes in all settings of healthcare. As we are having the many chapters and few chapters yet to develop, and also we are almost approaching to the 1,000 members. I'm very sure within a very short span of time we'll be cracking to the 1,000 numbers. So we are very happy to work together. And these are the people, the founder official. I must put forward. I can say Madam Thankam Gomez is the founder who had, along with other, this official conceived this ANEI. She was a founder president. Madam Jyoti Clara, founder national vice president. Madam Subhara Sakurikar, founder national secretary, and Captain Ajita Nair, founder national treasurer, who set the milestone and for ANEI. And the current official, Madam Miss Ajita Nair, she is the national president. I, Dr. Unmona Borgohai, ANEI national vice president. Dr. Vinci Tribhuban, ANEI national secretary, and Lieutenant Colonel Dr. Aji Cole is the treasurer. And this is the Empower Hour that we have covered. We are, yes, very rightly, we have come to the December. I can say Maharashtra has done before time, before the 20th December, and Miss Durga will be leading now, and Karnataka left, which will be done in the next month. Okay, so I'm very sure that very very quickly Maharashtra chapter is moving very fast. I'm very sure that till that time they host their national conference, they'll be exceeding the number. Then all total we have the ANEM members. That is my hope. And I'm sure today also they will do the great. And as it was for the patient safety, I just will read this slide only. why the Empower Hour dedicated to patient safety. Patient safety is becoming a cause of concern. So healthcare delivery requires coordination. Medical harm happens when the coordination lacks. Many safety checks that healthcare system have in place may not work as they should cause avoidable harm. It is now well recognized that patients too can play a significant role. They can share their issues and concerns so that we can redesign the healthcare system. So with this, we have almost came to the end of the patient safety, the theme on the Empower Hour. So I'm, anticipating the next, we'll be taking up some new theme. All of you can give the idea to Madam Calls it, that so that she will focus, and also you can choose the month that you are going to do. So I should not take much time. I can see such eminent, efficient, the speakers are here from Maharashtra, so enthusiastic, our chapter head Durga and Chubangi. I wish you all the best, and over to Durga.
Thank you, Dr. Almona. It was a wonderful introduction for Maharashtra chapter as well as Team Annie and the motto of Team Annie, passion to action. So with this, we start with our Empower Hour. It was indeed a very good initiative which Annie has introduced to, the word empower itself says that the efforts go into empowering every nurse and every healthcare worker. We are not just limited to nurses, but we cover the entire healthcare system when we have any activities. So with this, I request Dr. Shubhangi to introduce our moderator for today, Dr. Madhura Mure. Dr. Shubhangi, please put it on full screen.
Yeah. Is it okay?
Yes, yes. Please go ahead.
Yeah. Good morning, one and all. It's really, I am today privileged to introduce a unique personality in the field of healthcare. She is a very versatile personality, and I am really pleased to introduce today to her. She is Miss Madhura Mule. She has got extremely 25 years of experience in the healthcare field. We are really proud to have you with us, and I will proudly say that today's Empower Hour, a major share contribution goes to her, Miss Madhura Mule. She had done her MSc Nursing, then PG Diploma in Healthcare Management and Certificate in Hospital Infection Control and Patient Safety. She had done her Diploma in Quality Management and Hospital Healthcare and Orientation. She is a yellow belt from Quality Council of India from Six Sigma, and experience like she is presently working as a visiting faculty for MSc Critical Care Nursing students Mumbai. Then she is the ex-group CNO and head quality critical care Asia Multi-Speciality Hospital and Research Center in Mumbai. She had worked with Lilavati Hospital and Research Center Mumbai for 22 years in a different positions with Deputy Chief of Nursing Services. Then she was a staff development coordinator, nurse educator, ICN and SICN, and so much to her credit. Additional, she always keep on updating herself professionally, personally. Such a vibrant personality we have got. She is an NABH assessor since 2018 and a principal assessor since 2022. Then she is the AC CSSD auditor by 3M and CAHOS by September 2021. Course coordinator, post basic diploma in CCN course at Lilavati Hospital. She is a trained in CRRT from Gamro, Singapore. Then American Heart Association certified BLS trainer, instructor. Then she has also done a basic and advanced certificate program in infection control since 2022. And she is also appointed as a CNA speaker in various institutes across the Maharashtra. She has also contributed in setting the ICU critical care nursing practice standards for CCNS India and assessor training program completed for CCN practice. We are really privileged and proud to have you with us, Miss Madhura. So I'm handing over the session to you. Thank you so much for being a proud Annie member and be part of this really important session of Maharashtra Chapter Annie. Over to you.
Thank you so much for this introduction and a very warm welcome to everyone who are participating today in this Empower Hour session. As you all know, the session today is on safe communication between healthcare teams, patients, and relatives. And at the outset, I would like to thank the organizing team of Maharashtra Annie chapter for providing us this opportunity to be part of this Empower Hour session. My sincere gratitude goes out to the National President and National Vice President of Annie, Dr. Unmona, Madam, Captain Ajita, Madam, for giving us this opportunity to speak at the national level about a very, very important tool that is communication. And without this tool of communication, we wouldn't have been connecting with each other across miles and sharing this very, very important information and exchange of experience and knowledge among the healthcare professionals, because we want to reiterate that communication should be used as a very, very important tool for patient safety. And with that, I would like to welcome all the panelists who are going to share their immense knowledge and experience with us for today's session. And a little so before that, the Maharashtra chapter has taken up this important topic of IPSG2, that is improve effective communication, from the international patient safety goals to reaffirm or reiterate about the importance of communication. So the roadmap for today's session is that with the expert panelists, we would be covering basics of communication, what is the nurse's role, the quality perspective will be dealt by Ms. Pearl Cruz, the doctors and medical legal perspective will be dealt with by Dr. Paritosh Baghel. Ms. Priya Fernandez would speak to us about her experiences as patient and patient's relative. And overall, we'll try to have a concise and comprehensive, we would like to deal the topic of communication with you all. But before we start, I would like to introduce our expert panelists, and I am really very happy to have all of them who come with lot of experience and expertise in their field. And we would like to start with Ms. Pearl Cruz. Extremely delighted to welcome you, Pearl. Pearl is presently lead hematology research nurse at Queen Elizabeth Hospital, NHS, England. She's a MSc in cardiovascular thoracic nursing from SNDT University. She's an NABH principal assessor, Edward Jenner L1 NHS Leadership Academy UK. She's a certified CPHQ professional and a QSIR practitioner in England. She holds a Six Sigma Green Belt from ASQ USA and also has a certification in Total Quality Management from India. She's got more than 20 years of experience in her professional career. She was working as a Chief of Quality and Patient Feedback at Sir H.N. Reliance Foundation Hospital, Chief Nursing Officer at Apollo Proton Cancer Center, Chennai, Chief Nursing Officer at Gleneagles Global Hospital, Mumbai, and also was heading the nursing quality at Wockhardt Hospital, Mumbai. And for all you out there, new nurses or nurses choosing to have a career path, please follow Pearl because she's doing immensely well. And look at the achievements. You're so proud of you, Pearl. Kimpro Qualtech Award 2022 for Best Presentation, Times Health Leaders Award 2022 in Excellence in Patient Safety and Satisfaction, Midday Health and Wellness Icon as the Best Hospital for Patient Safety, Times Healthcare Award 2020, Excellence in Quality and Patient Safety, National Quality Conclave she has represented and presented on use of quality tools for reduction of IAD. She's represented India and at ISQA London Conference and presented on creating a system of safety through governance and data-driven decision-making. It's got Tokyo Conference streaming quiet time in hospital, Kimpro Convention 2016 winner for Quality Fable, ISCA Switzerland Conference Shared Nursing Governance, Asia Hospital Management Award for QIP on Pain Management Services, and a gold medalist for standing first at the university for MSc Nursing. We're truly proud to have you, and you have inspired me again to continue with doing a lot of studies ahead. So I'm sure all other participants must be also getting inspired looking at your CV.
Madhura one award, the recent award.
Oh yes, how can I forget that? The Bina Nurses Award, that is British
Indian Nurses
Indian
Association Award.
Nurses Association
Nurses
Award.
Association.
He has as a rising star, and really our heartfelt gratitude for representing India at this global level. Thank you so much, Paul.
Thank you, Madhur. I just have to put a disclaimer. If you look at the achievement section, there are
I
asterisks
have
marked
read that.
everywhere. So
Yes.
wherever I mark the asterisks, that's not solely my thing. I've just been a part of it, but it was the whole teamwork.
That's very kind of you.
That
I have
is,
never read a CV which says that disclaimer that I've been a part of this these
Yes.
award ceremonies as a team. So very good, Pearl. So next we have Dr. Paritosh Baghel. He's a senior consultant physician at SL Raheja Hospital, a Fortis associate. His academic qualification, sir has done his MBBS from prestigious Sir JJ Group of Hospitals, Mumbai, and then done his MD in internal medicine from KM Hospital, Mumbai, and has an LLB degree from Mumbai University and is a medico-legal expert. With more than 20 years of vast experience in teaching for the medical students, Sir was associated with JJ Hospital as Professor of Medicine and was heading medicine department at GT Hospital and St. George Hospital, teacher to medical students for more than 15 years. He has an expertise in treating infectious diseases, lifestyle diseases like diabetes, hypertension, heart disease, etc., and a certified trainer for BLS and ACLS for American Heart Association. His achievements include various publications at national and international level in medical journals and has been speaker at numerous medical conferences. He has headed the COVID unit at Raheja Hospital and successfully treated almost more than 5,000 patients of COVID with excellent result. Sir, we welcome you for this panel discussion, and indeed we are privileged to have you as a speaker for this session. I'm unable to see Sir's video.
Yeah, thank you so much, Madhura. Thank you. It's a privilege to be here on this, prestigious association, and and at an important topic which is really, really important as a healthcare provider. Thank you for inviting me, and thank you for the kind words. I'm looking forward for it.
As said by Mahatma Gandhi, that patient is the most important person in the hospital. So we have today the representative expert speaker who will be representing be an advocate for patient. And she is Ms. Priya Fernandez. She is the director at Riza Education Academy in Mumbai. She was former head of school at Rose Manor International School and a vice principal at Lilavati Bai Poddar Senior Secondary School. Madam, we welcome you for this panel discussion, and we are keen to listen from your perspective and how we as nurses can improve in our day-to-day communication from your experiences. Thank you so much.
Thank you, Ms. Madhura. Thank you, Annie, for making me a part of this discussion. I've involved myself many a times into educational discussion. Now, through this panel, probably I'll be educating myself as well. And I'm happy to represent the patients. And of course, after speaking to a few before coming to this panel, a few pointers and a clarification that I would like to take back home. Once again, thank you, the entire team of Annie, and thank you, Dr. Madhura, thank you, Durga, for making me a part of this particular discussion today. I'm highly privileged. Thank you so much. Looking forward to this entire panel discussion in a while.
Thank you so much, madam. So now we'll begin our panel discussion. Little bit about communication, which I will speak. Then we'll head on with the panelists to know about their experiences about communication and how to utilize in our day-to-day work function in the clinical as well as in the nursing fraternity. So communication is the solvent of all problems, and it is the foundation for personal development. And without communication, as I said, we wouldn't be exchanging all these information and experiences with each other. So by definition, communication is a powerful tool to address growing and complex health challenges. It is the process by which information is exchanged between individuals, departments, organizations. It is also defined as transfer or exchange of information from sender to the receiver. So 93% of the communication is non-verbal, which includes body language, attitude, and tone. And 7% is the actual words. To sum it up, it is the lifeline of the core team. These are the elements of communication. There's a sender who encodes the message and transmits the message via a channel or a medium. The receiver, the person who gets the message, he tries to analyze and then gives a feedback based on what he has understood. These are the basic elements of communication. I'm not going into the details of it, but for refreshing the knowledge of the participants, this is the communication channel, sender, message, receiver, and then there is the feedback. And in this channel, if there are barriers, we can have miscommunication. If the communication is what we wanted, if the sender intended to send and the receiver used it effectively or understood it and gave a proper feedback, then we'll try and have a effective communication overall. So let us see this. As in nursing, we say that when we are transferring or transferring a patient from bed to wheelchair or bed to the stretcher, count of 3, and they all thought that they'll be counting 3, and nobody did it, and the patient had a fall. So these are some things, or some what to say, to stimulate y'all to understand the importance of communication. Here the patient is telling the doctor, I have a sore throat for the last time. I don't have a problem with my foot. So please listen to our patients. Please listen to each other. So why do we communicate? We communicate to establish the nurse-patient relationship, exchange information with patient and family, ensure accuracy in delivering the correct treatment regime, exchange information with the healthcare providers, transfer responsibility of care, and ensure accuracy in interpreting information. These are the areas for also potential breakdown in communication for nurses. Remember, the patient and the family are the most important members of the healthcare team for communication. So what is healthcare communication? It is the exchange of information and instructions between healthcare professionals and between care workers and patients or family members. So it is the science and art of using communication to advance the health well-being of people and population. So it can be patient-provider communication, communication among healthcare workers, public health campaigns, and now the recent is the electronic and the digital media for healthcare communication. What is effective communication? Effective communication is the bridge that connects individuals, enabling them to share information, build relationships, and collaborate with precision and empathy. It is purposeful. It is goal-directed, creating beneficial outcomes for the patient. And of course, it involves a lot of skills like active listening, non-verbal communication, verbal communication, written communication, knowing about the cultural background of the person, empathy, and compassion. So effective communication is the cornerstone of success in healthcare. These are the various types of communication. I'm sure all of you all know. I will not go into the details of it. It will be written, oral, verbal, non-verbal, formal, informal, face-to-face. And there are various barriers to communication which can cause errors in healthcare scenarios. So the importance why we are talking about communication today, because communication breakdown among clinicians, patients, and family members can lead to medical errors, and effective communication may prevent such errors. So as per the Joint Commission report, ineffective communication was found to be as root cause of nearly 66% of all sentinel events. 80% of serious medical errors occur due to miscommunication between health professionals during transfer of care. And in the ICUs, it has seen that 37% of medical errors in the ICU are caused by poor communication between doctors and nurses. And definitely we here are going to learn today about how do we prevent all these errors at our functional levels. So these are some of the key facts and figures. And now it's because of lack of communication in healthcare, there can be various problems, like we can miss the allergy history, there can be medication errors, there can be diagnostic errors, or the critical alert that is being conveyed to the staff can be going wrong, and accordingly the treatment has gone wrong. So there are various examples which our panelists will share with us. So let us hear from them. I'll come back to the slide after we finish the finish speaking to Ms. Pearl. So healthcare has been communicating the same way for decades, and now it's time to change. Or are there any things that we can change in ourselves or in the system so that we can have better communication between the healthcare? So I would like to ask Ms. Pearl, as a quality leader, what is your perspective on this topic? And share your experience about the importance of communication for patient safety from quality perspective. And are there any standardized communication tools, formats for effective communication among healthcare workers? Over to you, Pearl.
Thank you, Madhura. Just a quick check of whether you can hear me clearly.
Yes, we can.
All right, perfect. All right, just sort of sharing my screen, and I hope that's visible, right?
Yes.
Perfect. All right, so thank you for that question, Madhura, and thank you everybody for joining in large numbers. I can see about 138 participants as of now. So the question that is asked to me is, what is my perspective on this particular topic? And the first thing that comes to my mind is safety. As a quality professional, that's one thing that we always focus on, whether it's patient safety, whether it's employee safety, whether it's the whole infrastructural safety. These are the three things that practically quality focuses on. And like we say, for everybody, for our personal relationships also, communication is of essence, right? The same way, communication is of great essence. And when we talk about communication, everybody feels this is communication, talking. No, communications are in various forms. Thanks to the digital platforms nowadays, we are trying to make foolproof communications, trying to integrate all the platforms together. So if a doctor does something, the nurse comes to know. If the nurse does something, the dietitian comes to know. So everybody can see what is getting communicated, so that we can make patient care very safe. So when I talk about healthcare professionals, or when I talk about patients and family, and when we culminate them together in healthcare, safety is first primarily. Second, I feel communication is important to protect our patients' rights, which sometimes I feel we give less importance in our Indian scenarios. But patient right is of prime importance. So communication is important to protect that. And that's where advocacy comes in. Advocating not just only for our patients, advocating not just for the families of the patients, but advocating also for our nurses. For all this, I think communication is very, very important. If I move on to the next thing, like Madhura already mentioned, effective communication is the cornerstone of patient safety. She has said that 80% of our errors lead to serious, the miscommunication is responsible for 80% of our serious medical errors. And this is a known fact. This is a proven fact. This is the data which is collected all across the world. And hence, when you talk about any accreditation standards like JCI or NABH, you will have a whole standard about communication. You will have this particular communication linked through everything. Say simple, for example, when I talk about early warning signs, how do we communicate that so that our rapid response team can come and catch our patients? That is a part of communication. Now, why is communication necessary? One, I feel like we all know minimizing errors. Very, very, very important. And sometimes as nurses, we are very close to the patient. We know what the patient is going through. But yet sometimes we do not have the courage to speak out. Trust me, my dear nurses, out of 10 times, 9 times a nurse is right about a patient. So I think to minimize errors, we need to speak up. Secondly, communication is very important, of course, to enhance team coordination so that people know what's happening with the patient. Like Madhura rightly said at the beginning, patient is the center of any healthcare activities, and that's why we also have a patient here as a patient representative here to talk about it more. And when we do all that, we establish a culture of safety, which is important because when I work in a safe culture, I feel safe, right? So we have to create a safe culture, and hence effective communication is very, very important. Patient-centered care, of course, and then finally, the law comes in and we says to reduce litigation risk. If I do not do something for the patient, and it's not documented why I did not do it, that means you have not done because of negligence. And that's where your hospital comes into litigation. I have some mentors in communication, mentors in healthcare who always used to tell that what is not documented is not done. And documentation is a form of communication. So communication helps us to also sort of reduce a lot of litigation that we come across. And Madhura also asked me what are various standardized communication tools. I'm not going to dwell much on this slide because I know that many of us belong to NABH accredited hospitals, which demand we have a standardized communication tool. And the common one that we know is called as the SBAR tool, which is Situation Background Assessment Recommendation, and which is usually used for our handoffs, or if there is any urgent clinical situation where you pick up the phone and you have to tell the doctors or the senior nurses what has happened with the patient. This is what we use. There are a few more as I started researching about communication tools, and what I've also experienced here. SBAR is used here where I practice as well, and it's used very, very effectively and well. There are other things which, other tools like CUS tool, which is concerned, uncomfortable, and safety issue, the acronym. This is basically which tells about when I talk to somebody, I say, I'm concerned about so-and-so for the patient. And I feel uncomfortable because my patient is going through this. And if you do not address this, my patient will land up into trouble. So that's the CUS tool, which is basically a firm tool for advocacy and raising alarms. We also know about read back and repeat back, right? Which we know we use it. Yeah, thank you. So read back and repeat back tools we know, which we use for verbal orders and for critical values. When the lab informs us about critical value, we sort of listen to it, write it down, and read it back. So this is one of the tools. The next tool that SOAP is something which we used to learn when we were student nurses. SOAP is another tool which I commonly use here in UK. We have to talk about pardon me about the typo errors, the subjective, objective, and assessment and planning. These are the 4 things. So I talk about my patient's subjective parameters, objectively what is vital signs and all, and what I have assessed about the patient and what I plan to do. So these are used when we jot down the clinical notes. We also know about WHO Safe Surgery checklist, which we know that it is done pre-induction. There is a whole checklist before the patient gets inducted, what we are supposed to do. And we asked the whole entire surgical team whether we have done this or not before the incision and before the pre-closure, so that nothing remains, foreign objects remain inside my patient. Huddles is another thing which we use commonly here, and that is a tool which we use in the during the handover time, where the entire team, including the nurses, including the some of the doctors who are responsible, And also the healthcare associates who are working with us, the cleaners who are working with us, everybody together. So we just go quickly through what are the goals for today for the shift, are there any risks identified, and what can we do about it. So we do have short focus meetings. I used to work in a place where we used to have 2 shifts, and during both the handover times we used to sort of use the short huddles for this. So yeah, that's my sorry, I think I'm just moving on ahead and ahead, but that's the take on my take on what this is all about. Madhura, over to you.
Thank. My screen is visible.
Yes, ma'am, your
My-
screen is visible.
Okay, so thank you, Pearl, for throwing light on the standardized communication tools. Because many a times our staffs are very busy in the clinical areas. They are burdened with a lot of patient care activities, and then these standardized tools, as we all know, becomes tick list. The checklist becomes tick list. But I really request all the staffs that please, these standardized tools are given as a pathway for you all, so that no information is remain pending of the patient's handoffs. So 23% of medical errors in the hospital are due to communication failure during patient handoff. And effective nursing handoff is a key factor for providing optimum patient care and increasing patient satisfaction rates in your facility. So requesting all the nurses that kindly fill in the S bar with not just ticking it, but understanding, and if anything is remaining from your shift, pass on to the next one properly. So this is one example. In a rheumatic OPD, the doctor prescribed methotrexate 2.5 milligram, 8 tablets once daily. The prescription was not verified for incorrect frequency. Usually it is taken once in a week. And the prescription was dispensed as written. Prescription was not counseled. And patient took this medicine for at least 10 days. And patient had some side effects because of it. He had mouth sore, skin rash, etc. And he went to the ER. The ER doctor also missed to do the reconciliation, and he just gave the antibiotic. When the patient went to his family doctor, and doctor noticed that the patient had the side effects because of high methotrexate levels. So there are various gaps at between the communication between the different level of healthcare professionals. For all of you all have various experiences. Can you please mute, ma'am? I'm sure that we all have encountered some or the other type of communication errors in our everyday functioning, like addressing patients by bed number, addressing.
I'll have to mute the talking participants.
Like addressing patient by bed number and saying that, please send the bed number so and so for this particular procedure, and the actual patient has been shifted in from that particular bed. So again, that's a communication error, and the wrong patient reaches to the different either OT or any other minor procedures. So we have to be so careful when we are communicating with each other as healthcare professionals. So I would like to hear from Dr. Paritosh Baghel. Sir, as a very senior leader in medical professional, we would like to know about your perspective on this topic about communication among healthcare professionals, communication among the doctors, RMOs, consultants, and between doctors and nurses, and also communicating with the patients. Over to you, sir. I'm sorry, I need to stop my screen.
Yeah. Good morning. Good morning, everyone. Madhura, thank you so much. I am joining through Dr. Durga Madam's laptop. Yeah, so I want to share my screen to you. Now, the topic is very, very relevant and basically about communication. When I say why communication is so important is one sec. Do I do this?
Yeah, full screen.
Yeah, full screen. Yeah. So, already it has been spoken about communication, and why we are talking about communication today is because the whole practice of medicine has changed. I mean, whenever a patient goes to a doctor, it is always understood that whatever the doctor tells has to be, accepted the way it is, and whatever it's the final truth, no questions asked. So that was how the medical profession started, and it was more of a paternalistic approach where whatever said by the doctor or whatever the doctor takes a decision on behalf of the patient used to be like final. We don't ask questions. We just listen to it, whether it is right, whether it is wrong, whether to ask questions. That is something which was never there. But later on, as time has passed on, there has been a significant shift in the way where patients' rights, patients are treated, the way the medicine has evolved. Now there is too much of, I mean, there is definitely an emphasis on patients' right, their autonomy, the right to make their own decisions. And that is where communication plays a very, very important role. Because today, if a patient is understanding what what he's going through and what are the treatment options, then he can take an informed decision about the situation. So that is where communication is important. And already said, as in medical in healthcare system, communication plays a very important role, because we communicate on a day-to-day basis with a variety of people. Like, it's not an individual, just the patient is here. There is an interaction going on constantly. Say, for example, when we are treating one patient, it's not that you are dealing with that patient only. You are in consultation with another doctors, there is nurse, there are patients, there is other non-clinical staff, you are talking to the relatives. So a lot of communication happens, and this is a complex scenario. Because it involves medical as well as non-medical communication, and that is throughout the day, 24/7, 365 days. And we as a healthcare professionals are working in a very stressful and an emotional environment. It is not a place where everything is just hunky-dory. There are patients who are with their sufferings. We have to be communicative in a way which can understand their pain, and you can be empathetic towards them. There is high stakes of working conditions, because we have to see that the patient's safety is not hampered, patient improves. So it's high stake working condition. Also, at the same time, when we look at our healthcare system across our country, I would say definitely there is a lot of workload burden. There's staff shortage. There is the ratio of doctor to patient and nurses to patient ratio is definitely not in good numbers. It's definitely skewed. At the same time, time is an essential in our profession, because we have to take at times spot decisions regarding the treatment of our patient, and all these things are important and can be done in a proper way only when there is a proper effective communication. And communication is just not about speaking, as what rightly said by Pearl, that it's just not speaking, it is non-verbal as well. Writing, what we write in our notes is important. How we communicate, the example which you gave about the methotrexate, it has actually happened, and I have seen a patient who had taken methotrexate for days together, and he came with a bad skin reaction. He went into a drug reaction where he came with rash all over the body, with ulcers over the skin, with ulcers in the mouth. So yes, communication was important in that aspect. And at the same time, a lot of non-verbal communication in terms of body language, the way you speak to the patient, the way you speak to the relatives, carries a lot of importance in our profession. And when, in 1999, the first report, which was prepared by this Institute of Medicine in US, looking at what happens in medical profession, are there errors which happen? So there was this good report which came, to err is human. And this was all aimed to build a safer health system. And it found that almost 44,000 to 98,000 deaths used to occur in America only as a result of medical errors. And it was surpassing many other causes of death. It was almost 8th leading cause of death at that time. And even today, it is still happening, that there are medical errors happening day in, day out. And mainly because of the communication errors or miscommunication or misinterpretation of what you communicate is happening. There have been studies where they show that communication being a major part which leads to lot of adverse events. And when we talk about patient, the whole primary aim of any healthcare system is that the patient should be safe. Patient safety is what comes. So as you can see here, I have this BMJ article which has studied about how does communication affect patient safety, and they have found, yes, communication is almost 60% of the times where communication factor as a contributing factor, poor communication, almost 60% of the adverse events are because of poor communication. At the same time, medical negligence cases, as we see, majority of the cases which are happening now, there is a significant surge in the number of litigations which are happening against medical professionals. Apart from the litigation, there is a lot of violence which happens against healthcare professionals, and that has got to do, lot of things got to do with communication. So miscommunication is a leading cause of medical malpractice claims, as you can see here, and that is where the communication is very important. And there have been a lot of barriers to communication. When we look at these general barriers, it's a personal barrier, where language barrier in our country, there are people with different languages, and so it is important when you communicate. It is not, it may happen that you may not be able to communicate with the person only because of the language barrier. He may not understand the language which you are speaking. There could be social and cultural barriers. There could be a lack of knowledge. There's a lot of unawareness in our population regarding medical profession, regarding the treatment, regarding the various diseases. That also hampers effective communication. You may convey, maybe the patient has not understood it. Maybe he's not understood the gravity of the situation. It does happen that when we speak to the seriousness of the patient, and even after explaining, the question which comes with our with the patient's relative is, "Per theek to hai na wo?" Despite telling that patient is in the ICU, patient is really bad, not doing good, they don't register it. So you have to understand that for a communication, to have it as an effective communication, so that the thing what you want to convey goes properly and is understood in the proper sense by the person who's receiving it. At the same time, there are other factors like training inconsistencies. As we know that in our medical teaching, I don't think there was anywhere impetus to teaching the communication skills. Although our government hospitals are definitely burdened with number of patients, there's hardly any time. So there is hardly any communication which used to happen in our OPD and all that. So training inconsistencies are one of the reasons of ineffective communication. Misinterpretation, misunderstanding of information which is provided. Time constraints, very important reason for barrier for effective communication. At the same time, there is no set protocol of conveying an information. As what has been said, these are the various protocols like SBAR, CUS, and huddles, and all those things. They are very important, because otherwise the communication among the healthcare professionals can be one of the big reasons for hampering the patient safety. At the same time, if the communication, if there is a distrust or a discomfort to begin with, a prejudice in the mind of the patients, obviously the communication cannot happen. So you have to bridge that gap by doing an effective communication. And what does effective communication do? It builds the trust and the rapport among because the most important factor between in healthcare profession is the relationship between the healthcare person and the patient. So that trust and rapport can be built by a very good skill set of communication. It helps in better decision making, making less errors. It improves the standard of care of our patient and improves the patient satisfaction. At the same time, among the healthcare workers, the communication, there is a good team, it helps the dynamics of the team. It leads to job satisfaction. Everybody feels that they are part of it, and they feel better in treating the patient. Their performance will get better, and hence the patient safety will improve. At the same time, there could be a decreased workforce turnover. I would like to work in a situation where it's cordial, it is respectful. Obviously, I would like to work in a situation, and we are dealing with human lives. So, it's a stressful situation. So if the environment is good, the communication is good, then obviously the outcomes are going to be good. And this is why I think communication plays a very important role in healthcare. My perspective is that in our country, it has to be dealt in a better way. Teaching has to be done, right from the start, when a person enters into a healthcare profession, sensitization towards better communication, to be empathetic towards patients, to give time, all those things have to be inculcated right from the time when a person enters into healthcare system. And that is what is going to help. And that is what is going to improve the patient safety.
Thank you. Thank you, sir,
Yeah.
for your enlightening information. Now, one of the participant here has said that Ms. Jyoti Kumar, she says that important to address difficult patients, VIP syndrome, emotional regulation of staff, and escalation metrics. So some part of it, sir has dealt about, how we can actually address or speak to patients in general. But some of the other aspects are active listening, showing empathy, simple language, being mindful of non-verbal clues, where you're talking to the patient, but your mind is somewhere else. These non-verbal cues can really distract the patient and the family members. Also, VIP syndrome, yes, I understand VIP syndrome when you have to handle high-end patients. Uh, Really, you have to be gentle, calm, and listen to them, but be clear and concise whatever you want to communicate with the remembering the protocols of the hospital. So the standards of effective communication deals with that: complete, clear, brief or concise information, timely, and be assertive wherever required without being rude. And escalation metrics will depend upon the patient's, the hospital's protocol, whom you need to escalate in case the situation is going out of hand. And some of the hospitals do have code purple or code violet to handle violent patients. But if there are problems, like simple problems where patients have grievance or complaints, then we do inform our patient coordinators or customer care supervisors or the head nurses if you're a staff nurse at in your hospital. So different escalation metrics are available as per the hospital's protocol. So thank you, sir, once again. I would like to move on to the next panelist and our speaker, Ms. Priya Fernandez. Ma'am, as a patient advocate, oh, I'm so sorry. As a patient advocate, what is your experience about communication with patient by healthcare professionals? Whether it is the nurses, doctors, or other technical staff, what was your experience when you were admitted as a patient?
Thanks, Ms. Madhura. Okay, now, when I, as a patient, or people like me, go to the hospital or go to a healthcare, person or professionals, what we definitely know you mean good to us every time you say, okay, this is what you need to do. Okay, we also know that you're trying your best to cure us and give us, the right advice. But the patient is the most vulnerable, when they come to you. Okay, we don't know what's happening to us. So that the reason why we are there is because, they say Dr. Bhagwan jaisa hota hai, yeah, nurses are like, God, because we don't know what to do with us. It's like a child's hand stuck into the bottle does not know what to do with it. Yeah. So it's something like that. So we are most vulnerable. We trust you, but we don't know what's going on. And that's why we're hysterical at times. So what, as a patient, we would expect out of you is first, give us a clarity and understanding. Okay. When somebody wrote VIP syndrome there, I thought it is some syndrome like Down syndrome or something. I actually Googled, okay, to check what is VIP syndrome. Now coming back, when doctors or nurses use words like biopsy, sepsis, trauma, all right, it gives us jitters. We don't know what it is. Yeah, it could be something simple. Yeah, but when these words are used, we basically get jitters. So we need somebody who will calm us down and explain to us and give us a clear, jargon-free, and easy to understand terms. I know some doctors and nurses and healthcare workers, okay, persons do explain this to us, provided we have enough time okay? But it's important that we understand what's happening. Also, the treatment that's given to us should look simple. It shouldn't look like, oh bhai, jaldi jaldi aa gaye, jaldi injection de diya, jaldi sab kuch laga diya. We are wondering, whether am I going to die in next few minutes? That shouldn't happen to us as patients. So we require something that is completely clearly spoken to us, and we are given a complete understanding without much technical language or abbreviation. Give it to us in simple format without confusing the patients, okay? We feel overwhelmed and unsure whether the treatment is right or wrong because we don't know what it is. The second thing we expect is empathy and compassion, okay? We are completely unaware, especially the first time that we come for treatment. So we request an empathetic approach. That will probably help, build trust. It will build, if there is compassion, if we are being heard, listened attentively to, there is a little emotional impact. For you, maybe it's day to day that you see thousands of patients, but for us, it's a first-time experience, yeah? So if there is something like a rushed behavior, if there is something that is dismissive, आपको लगता है कि भाई छोटा सा है, चिंदी है, it's not very important. But for me, it is very important as a patient to know certain things. So we expect that empathy and compassion, that we are not dealt as just another case, but we are looked into as, bhai, your life is also very important, so something like that. We also, as patients, would like to be respected for our preferences. Yeah, sometimes things are given to us and probably told, this is best for you, you should do this. This is the line of treatment, go ahead. Again, I'm not generalizing. There are beautiful doctors and healthcare professionals who treat us very well. But there are times, we don't know what's happening. So give us a choice at times. So we need to be given preferences so that we can probably make, right decision, okay? Preferences like, in treatment and lifestyle, what are the options that we can cope up with, can we take up, etc. Okay. Also, if you're not given this option, we are trying to kind of, have a doubt. As I said, in that state that we are in, we'd probably have our own doubts. Ki bhai, ye hamare liye kar rahe hain ki nahi kar rahe hain. That's something that we come on to. Also, at times when the patient needs to talk to healthcare professionals, maybe they're not available, okay? And that timeliness and availability, that's my fourth point, which is very, very important. Yeah, could be, as a patient, I must have a little patience as well, but I need to also understand, or rather, I need healthcare professionals to also understand, as patients, we are vulnerable. So give us timely updates. What's happening? Okay, fine. This is what is the line of treatment we have given to you. So what is the next step and what is going to happen in the next step? Yeah. Then our questions should be answered by somebody who can probably, talk to us, update us on our progress, so that we are feeling much at ease, okay? And a quicker check-ins for reassuring us that, everything is going fine. So whenever there's delayed responses, whenever there is no follow-up or follow-up calls, etc., when there is difficulty in reaching into the doctor, the healthcare professionals, then what happens is it increases quite an anxiety into the patients. And that anxiety, we've heard of so many times where patients or patients' family members have gone out of control to at times even rampage, the clinic or the hospital. That's only because of the built-in anxiety. Kya ho raha hai, humko pata nahi chal raha hai. Yes, that is what it is. Also, my fifth point would be the patient advocacy and support system, and the support that should be provided. Now, what happens here is, if there is somebody, who you feel is, other than the patient, is even more vulnerable, okay, then can somebody else step in, like maybe a friend or a other family member or relative who can probably break down what you're saying and talk to the patient at the same time in your presence, of course, so that we can have a better communication. Yeah, it could be a language barrier at times. You're explaining in Hindi, English, Marathi, but the patient doesn't understand probably. So this advocacy or support system, what we are talking about, should basically be something that we should look into, so that effective communication happens. At the same time, you're aware that what you are communicating is rightly going to the patient. Okay. Otherwise, what the patient will feel is isolated. Like, you are explaining everything to my husband, but I don't know what's happening. Yeah. So my husband knows this is the line of the treatment. So I'm feeling isolated in the whole process. Yeah. So when I had my C-section in 2004, I was literally not knowing what is happening to me. I had gone in, walked in, everybody told me it's going to be a normal delivery. But I ended up, after 72 hours of, I think it was almost 60 hours of labor, that I ended up into something. No, I think I've made a mistake. It's just about 2 days, 1.5, 2 days of labor. Anyway, so ended up into, 7 cords around, umbilical cords around my baby's neck. My baby was absolutely in a distress. I don't know what was happening for 7 days when she was in the incubator, into the NICU, sorry. So these are the things which I was not aware of. Everything was explained to my husband, but somebody should have also communicated, or maybe, my husband should have been, trained to basically communicate this to me. So that did make me feel very frustrated, neglected, especially not having clarity on my condition. But during my second C-section in 2007, I was very comfortable, because by then I knew what was supposed to happen. Yeah, so I just walked into the hospital in the evening. My baby, or rather in the next day afternoon, I walked in the evening. Next day afternoon, my baby was out. I was feeding the baby sitting. The doctor was wondering ki bhai abhi C-section ho gaya, aap baith ke feed bhi kar rahe ho. So I was quite prepared when my second baby was delivered by C-section, and it was a choice to take in a C-section, because I thought, why distressed the baby? I mean, that is what, and I'm happy I took a decision like that. Okay. Coming to next, we also want a multidisciplinary communication. Now, what do I mean by that is, in an ideal setting where the doctors know what the nurse is doing, the nurses know what the doctor is doing, and the technical staff knows what everybody's doing. So the whole course. Otherwise, every time I talk to a nurse, it's like, doctor aayenge tab baat karenge. I will check with the doctor and let you know. But if the nurse knows what is happening, the nurse can comfort and say, kuch nahi, this is what doctor said, this is perfectly fine. Yeah. So if there's if there's a lack of communication among healthcare teams, what would happen is there's a mixed message spread. So who is basically trying to play around? Probably either one of them is trying to play around with me. I mean, I'm just talking about human feelings. I'm not really, trying to put up anything here. Yeah. So there is always a contradictory information, therefore, and this is what probably, the medical errors that we are looking at. Yeah. So the patient is trying to communicate something, the doctor is understanding something else, the nurse doesn't know what is happening, or the nurse is trying her best to do it. But this is where we talk about, as far as mixed multidisciplinary communication. Everybody should know that this is the case of this particular patient, and for next 7 days till the patient is there, or whatever days it takes, this is what is going to happen, and updated on day-to-day basis. And lastly, cultural sensitivity. Okay, now we all come under with so many different religious behalf. So when the patient says, "Aaj mera upwas hai," obviously, if the patient is coming dehydrated to you completely, I understand you need to start the line of treatment completely. But sometimes, just cutting the patient off and not understanding and saying, "Ye zaruri nahi hai," okay, is not, instead, if you could, kind of being a little sensitive and tell them, okay, we understand, ये आप अगले साल भी कर सकते हो, उपवास है, जो भी है आपका. But right now, this is what we need to do with you to get you to proper health. So this is what we look at as just putting up pointers, the 7 pointers I put up. I said, 1, clarity and understanding. 2, empathy and compassion. 3rd, I would look at respect for patients'
I'll sum up, ma'am.
preference. timeliness and availability, patients advocacy and support, multidisciplinary communication, and cultural sensitivity. So this is what I would request as a patient coming to the healthcare professionals. I mean, touch wood, till date, I've been under the best healthcare as far as anything and everything that I've been to. But I would definitely dread the day that I would not get an effective communication. Yeah. Thank you so much, Ms. Madhura.
Thank you, Ms. Priya. I think you have summed up so comprehensively the entire gist what patients want. I'm sure our nurses are going to benefit because you have given so many live examples what is happening in the hospital scenario. So to sum up, you have tried to say that we should be simple, we should be clear in our information that we are giving. No medical jargons to be used by nurses when you are talking to the patients and relatives. Actively listen to the patients, talk to them, understand what they are saying, and also before doing any procedure, anything, please inform them and timely update them about the next what is going to happen with them. So all that from the patient perspective we have heard from Ms. Priya. Thank you very much for that. And because we are going out of time, I'll club the next questions now. And our next question to Ms. Pearl is, from your so many years experience in quality, can you please highlight and share a few experiences causing communication barriers with incidents and events? And also, what is the difference, as you are in UK presently? So what is the difference? Is there anything that we can learn from the Indian nurses from the UK pattern? If you could throw light on that. So I'm clubbing the last two questions together because of the less time that we have. Thank you. Over to you, Paul.
All right. Thank you, Madhura. I think because of paucity of time, maybe I'll just stop sharing my screen and just talk about it. So I think the classic example, there are many examples of miscommunication. Okay, there's a Pandora's box I can pull out. But just to give you a very, very simple example of communication error that I have seen. We had this patient who came back, a patient whom we had put stent, came back with the stent blockage. And of course, we did a redo stent and everything. But when the incident landed on my desk, we started looking at what happened exactly and why did this patient who recently had a stent put in, why did this patient come back? And then we realized our patient has not been having the antiplatelets, the clopidogrel that the patient was having pre-stent, and he was not continuing it. We looked at why did this patient not continue? When we looked at why this patient did not continue, it was not there in his prescription. When I talk about RCA, I always go asking why, and why it was not on the prescription of the patient, because the doctors didn't put it. Why did the doctors not put it? Because somebody forgot. Why did he forget? Because this patient was on a clopidogrel before the stent, and why did we stop it? We all know because pre-procedural we do stop things which cause bleeding. Now the whole thing, when we went why, we realized that we lack something called as medication reconciliation. Now, what is medication reconciliation? This is a simple form of communication where I ask my patient, what tablets were you on? And I put that in a list in my patient's records. And then I need to remember to go back to that list and restart this medicine. Now, one more line that my mentor always used to talk is errors do not belong to the person. The error belongs to the system and the system belongs to the management. So there is nobody who is responsible, not the doctor, not the nurse, not the patient, but the system who is responsible who caused this error. So how did we correct that error? We brought our EMR where we sort of had this thing of medication reconciliation, which gets put in the patient's prescription. And when we are discharging the patient, my pharmacist gets an alert saying that, have you looked at the reconciled medicines earlier? Have you looked at those? Do you want to re-prescribe those? So technology can be beautifully used for recollection of memory. So that's one classic example that I can think about. Many examples, paucity of time. So we move on to what are the barriers of communication, which Dr. Paritesh has spoken about. But I think one thing which I'm going to just talk about 5 things which are different ways of barriers that I feel. One is hierarchical. Like we said, and this is basically because A&E, I'm saying nurses. We feel doctors are God. We feel we're not supposed to say anything. I would say speak up because you're with the patient. So that's one barrier we should cut off immediately. You know the patient very well. Culturally, we feel that we are not supposed to talk. Please speak up saying, I feel this is like this. whether it be right or wrong, but you need to speak up. The second barrier I feel in the nursing scenarios is lots of work on our nurses' table. That needs to be cut in. Third is the staffing ratio of our patients. Our nurses look after like many patients. Even if we look after 5 to 6 to 7 to 8 patients, there's so much work that the staffing ratio is too much for our nurses. The next thing is fragmented communication. Our communication is in bits and parts. Our ICUs probably will have 4 to 5 softwares open there. We have online communication, we have digital communication, we have on paper. So all that fragmented communication, the nurses get confused. कहाँ मैं इसको देखूँ, कौन सा system खोलूँ? Philips का system खोलूँ कि हमारा EMR खोलूँ कि क्या करूँ? So all that needs to come in one place. So I think these are few communication barriers we sort of need to avoid. Next question that you asked me, classically, Madhura, was how do we sort of what is that from what I have learned from UK that I can sort of probably pull out and tell to our nurses. I am sorry I'm not able to share my slides, but I will quickly sort of tell you what all I think that we can put together. I think the first and foremost is the EMRs that we have created. I think that is beautifully used in UK. People can really pull out those things, and like I said, the fragmented communication part of it is taken off. The next thing I feel, culturally, it's a more literate place. Culturally, they speak one language here. So, like in India, we don't have to speak so many languages. So they have an advantage here because everybody understands English, everybody speaks English. But having said that, some of them can't read English. Okay, some of them can't write English. We should know that about UK. They can speak English. But the thing is, they are well read. What I realized, they know terminologies. Whenever there is a condition, they go back and read, and they come back. I would literally tell in my research clinic, patients come with a diary. They will write down what questions they need to ask the doctor, and it is their right to know. Okay. Third thing, they get adequate time. It is not like our doctors or the nurses rush into things. If your patient demands 1 hour from you, you have to sit down there for 1 hour. It also comes with the fact that it's NHS, it's free healthcare. So, those things are taken care of. Third thing I feel is here, in terms of communication, privacy and confidentiality is taken at a very high level. Okay. Sometimes a patient may not want the spouse even to know about what she's going through. So the first thing the doctor or the nurse would ask is, would you like us to tell this to anybody? If they say no, it's a complete no. If I recommend a treatment to the patient and the patient says, I don't want it, I will not give it. It's up to the patient. So there is a lot of patient autonomy. There is a lot of shared decision making. It's up to the patient. The doctors will never say, मुझे लगता है ये ठीक है. नहीं, doctors बोलेंगे देखो आपके पास ये alternatives है. Alternative 1, 2, 3. इसमें से क्या choose करना है? इसका pros and cons. They will give you with facts saying this much percentage possibility is there that you will survive this, because I work in a cancer setup. And it's up to the patient whether they want to be in my trial, they don't want to be in my trial. So there are a lot of facts which are used. I think few of these aspects, let me cut it short down here. Few of these aspects I think can be adopted from UK to probably back in India. Thank you, Madhura.
Thank you, Paul. Because of paucity of time, I'll move on to Sir to ask him. Yes, somebody said something. Yeah, so Sir, as a medical legal expert, we would like to know from you how we can safeguard ourselves as healthcare workers. So if we are safe, the hospital is safe. And also the patients by using correct communication techniques. Are there any do's and don'ts? And the next question to you is about the leadership, like what the leadership at the hospital can do to bring about the change or to bring about effective communication in the hospital. Over to you, sir.
Yeah, Madhura. So, I think very valid points raised by Priya, and I think she has summarized everything about what lacks in our, communication with our patients, and it is quite evident. Yes, a lot of improvement has been done.
Make it quicker, sir. We have a very short time.
Okay, 2 minutes. And I think Pearl has also put up these changes which we can do, and a lot of things to learn from UK. Yes, there are certain barriers as a country, but then we can definitely look into it. Now, regarding what to prevent the issues which can arise because of lack of communication, I think there should be a more teamwork approach in, as what Pearl said, that there should be the hierarchy is a big barrier. And yes, one should ask questions. I mean, I always tell my nurses that you should be a part of the treatment. You should ask questions. Whatever the doctor says or doctor has prescribed, it is important for you to ask the questions why it is being done. You should be a part of it, because you spend majority of the time with the patient relatives, and they will come to ask a lot of questions. And if if you are part of it, you will be in a much better position to answer, and you would be able to allay the fears and anxiety of the patients and their relatives. Also, maintaining a good rapport with your healthcare team. Never talk low. Many times I have seen that there is a communication in which the junior doctors are made to feel that they don't know much about the treatment, much about the drugs. And then what happens when the consultant is not there? It happens that the patient's relatives also feel that, asking this junior doctor would not be good enough. He would probably not a good advice. That is also one thing which I see in our practice. Third thing which we can do is regular training and sensitizing the staff in terms of knowledge sharing, case clinical discussions where everybody should be involved, and sensitizing towards better communication in which you can allay the fears of the patient. This is one thing which you can do. Next, as an organization, I think organization should also be in a position to take some steps in terms of, as there is a significant skew in the ratio of the doctors, patients, and sisters and nurses. So, avoiding the stress, or making sure that there is empathy training of the staff. There are stress management sessions for the staff, because it's a stressful job. At the same time, there should be regular events which lead to communication, focusing on communication, how to communicate and understand the needs of the patient and address them. Informed consent, as what has been said very clearly, that informed consent should be done in terms of that the patient should be explained in simple and in a language which they understand, the pros, the cons, the options available in terms of treatment. That has to be conveyed to the patient in a very simple and lucid terms. Then only we can understand that they are understanding the situation and they can take a better decision about it. As a leadership role, what I see that nurses are the backbone of the entire healthcare system. It's not an overstatement. It is, and they should take this role as clinical leaders, because they are the first ones to identify the patient issues. If I were to see in any hospital setup or in anywhere where there is a patient safety issue, the first person who picks up these things is generally the nursing team, and they are able to mobilize the resources and they put solutions to it. So active involvement of the nurses in terms of as a clinical leader would definitely empower them and help in preventing the errors, negligence, and miscommunication. And also, I feel that there should be more of an administrative and managerial position role of nursing staff, because I feel that as a knowledge of having a medical background puts you in a better advantage as compared to people who are coming from a non-medical background and taking managerial positions. This is what I feel as a leadership role of sisters. They can play a central role in improving the patient safety by having as a leadership role in clinical management. Also, I was reading about something, and there was this hospital safety board concept of hospital safety board, where there should be it should comprise nurses, doctors, and personnel which are trained in quality and safety, and they can do audits and they can do this regular study and monitoring of our patients to prevent this and make a better place for improving the patient safety. This is what I would say.
All of us here in the Empower, thank you, sir. All of us here in the Empower are want to empower our nurses to speak up. Yes, and also the mantra is focus on the system and not just the people. So having said that, we have a question now to ask Ms. Priya, but I request you to keep it a little short. As a patient advocate, any experience you would like to share, or how can we make our patients go from satisfaction to a feeling of delight? Can you keep it a little short? It would be
Yes, Ms. Madhura, as I said, I would just give in pointers. I don't really want to elaborate. In fact, experience, I think in day-to-day life, you go through so many. So I don't want to really sit and share an experience. What I would just come to is to make the patients feel from satisfaction to delight. The first point I would look at is active listening, which we have already said or spoken about. Acknowledgement. Okay, if we are saying I'm feeling scared, just acknowledge it. That's it. We are with you. You're feeling scared. Fine, we are with you. You know,
Yes,
so
ऐसा
that
नहीं
will
होता है
validate.
मोस्टली स्टाफ्स में आंसर ऐसा कुछ नहीं होता है सबको होता है so
I
that
know.
is should be avoided.
So,
Yeah, correct.
validate the patient's feeling. That's what we're looking at, acknowledging our emotions. That's one. Second is personalized care. Okay, now I'm getting myself into the hospital, giving under your care. I would expect a personalized care, or any patient would expect a personalized care. तुमको वही हुआ है जो सबको होता है, वही disease है, and therefore you're going to give me the same line of treatment. That's not what I want to hear. For every fever, crocin is the treatment. That's not what I want to hear. मैं घर पे भी ले सकती हूँ. But what I want to hear is that you're giving me a personalized care, even if it means same thing that you're doing for all patients like me. Yeah. So I would expect providing choices, giving me adjusting, that would also include adjusting room temperature to the temperature I want in the hospital bed that I'm in. Okay. Proactive updates and communications. I would like to get an updates, and I would like to hear the same thing from the doctor and from the nurse and from even, the person who's doing my USG, or probably who's doing my ECG for that matter. Yeah. So I would like to hear same thing. Yeah. Of course, no patient wants to hear that they're going to die soon. They all want to hear that they're going to live and they're going to do well. But at the same time, I want to hear the same thing and not different things from three different people that are being looked after. Anticipating the patient's need. The patient is lying on the bed. What is the next thing the patient is going to ask? You should know. And if that is made available to the patient much before the patient could ask, it may be something like maybe, the water jug next to my bed is already filled up and kept before I would ask. Even that gesture would mean quite a lot, to a patient. Yeah. So anticipating needs of a patient. Now, this is very important for a patient. That is what would possibly take me feeling, quite delighted and knowing that I'm in right hands. Yeah, they already know what is going wrong with me. They already know what I'm expecting. And therefore, I am now in the right hands is what I would basically feel as a patient. Yeah. So these are the 4 pointers. I wouldn't repeat them. They are the same pointers.
Thank you so much for your input. So one of our participants, Ms. Jyoti Kumar, has very rightly said in the chat box that we are here to treat patients and not the disease condition. So we appreciate your participation, Ms. Jyoti, for communicating with us here. So this is one of the cartoons I would like to share with you all. I told you to cover his eyes with an iPad. And I told you to take 3 teaspoons daily of medication, and the patient actually took the 3 teaspoons. So these just a funny side of it, but we may never know what so many things happens, suppositories are taken orally. I mean, there are so many different types of errors that we have seen because of the miscommunications. And nurses play a very vital role. They must develop the trust, build a good IPR with the patients, and be good listeners, as everybody has been saying here, and empathize, maintain an eye contact, and must be aware of their own non-verbal clues as well. Lot of responsibilities on nurses' head. They may be saying, ye bhi karna hai, wo bhi karna hai, plus ye bhi dhyan rakhna hai. Yes, we have to learn all these things because we are the professionals who are actually in direct patient care, and the gates come and end at our place. We have very less chance of error. So that's why we need to learn all these things. And this Empower session has been only to reinforce about the information about communication and its importance. So having said that, I would like to conclude by saying that effective communication between providers, between nurses and patients is essential for the delivery of safe care, quality patient care, and successful outcomes. Examining our patterns of communication and identifying opportunities for improvement should be done at the leadership level and at the patient safety boards, what sir was saying. And all NABH accredited hospitals, sir, as you may be knowing, has the patient safety committee. And there is a patient safety officer who's appointed by the hospital. Nurses are encouraged to prioritize and refine their communication skills, ensuring that they remain at the forefront of delivering empathetic, high quality care to those in need. And effective communication methods are vital to dignified care, and our patients deserve nothing less than that. And that's why we all nurses need to educate ourselves time and again, refresh, reinforce our knowledge about this simple yet very effective tool of communication. So all you listeners there and participants, sit back. We are going to have a power-packed quiz time. And before the quiz, we'll take a small poll about knowing how much you have understood from this. And later there's a quiz, and the winners of the quiz will be getting exciting prizes from UK, from by Pearl. Okay, so let us have the poll first. Sheetal, can you please put the poll? I
Yes,
request
ma'am.
all the participants to immediately answer the polls and poll questions. So in case we have missed out anything during our session, the poll may cover through these questions.
Click on gesture na. Answer it.
Shubhangi ma'am, please
Yourself
mute yourself.
muted.
Which are the following not a key carrying?
Can they go next to the next question on their own? Okay, that's.
No, actually, I think what they can do is just click
All
on get the
questions are
QR code. Every participant can click on get the QR code. The QR code will come and then you can take the poll, which will appear here.
I'm able to get. Participants are able to fill in the poll?
Ma'am, they are, because we are receiving the responses.
All right.
Madhura, I think, yeah, okay.
Yeah, good. They're answering.
They're answering. Yeah, I was wondering if they are getting the QR code here.
Hello. The time the participants are busy, I would like to say something to the esteemed panel in front of me. And on the very onset, I congratulate the Maharashtra chapter the way I expected, more than that you have done. And the speakers that you have selected, no words to say, marvelous. I'm grateful to Dr. Paritas, and of course, Pearl fitted her odd time to our best time and gave her best and making it go. And particularly, I what to say about Madam Priya, the patient part, I really lost by listening to you and forgot from where you are. You are a best teacher. Yeah, of course you are. But you are the best healthcare professional teacher, I can say. You can add on to it. And
Thank you,
I
Madhura.
thought,
Pleasure.
yeah, I thought we'll be ending the patient-focused discussion today. I mean, by this year in December. But I'm thinking it will be not enough. We can talk again and again, giving more focus and importance to the patient perspective. And it was really wonderful. I just will take another 1 second to say one thing, cultural sensitivity. There was a patient, that is the mother of our CMD in the hospital in ICU bed. One girl was feeding her a spoon inside the mouth. The patient asked, "Are you Muslim?" Then the girl didn't know what to say. She said no. She came back, the girl was Muslim, and she said today in church, from next time she's a 85 years old lady, I lied her. There was no way for me what to say because my spoon inside her mouth, and she would have got a shock if I say, because she doesn't want to take food from Muslim. Okay. So I'm just saying it is like, that is not the Hindu Muslim thing. We know, but sometimes you have to respect that cultural sensitivity. So when you said about the cultural sensitivity, this came to my mind. And I'm really very much thankful. And of course, Madhura, that you are doing marvelous. And behind the screen, Somangi and Durga is working a lot. And congratulations from my part. Thank you once again. I'm feeling very happy. I led this Empower Hour for entire year, and it's gave me so much of delight and satisfaction with winding up the year with the Maharashtra chapter and these marvelous speakers. Thank you.
Thank you so
Thank
much,
you, Ms.
ma'am.
Sunmona. There is one more person behind the screen. That is our State Secretary, Sheetal Kamble. She
Yes,
also has
yes,
been
yes,
really
yes.
working a lot for this Empower Hour.
Yes, Sheetal,
Definitely.
please pardon me because I can see only my picture and this 4 picture. So I missed, and as I'm communicating to Durga and Shobangi, so like I missed Sheetal to mention about you. I'm so sorry. Yes, you are also doing and communicating about all this, about this Empower Hour. Thank you, and please pardon me.
Thank you, madam, for your inspiring words. And I would like to thank my panelists who've been so enthusiastic, energetic, full of information and experience, which has kept our audience engaged. And of course, yes, we have just touched the surface of the iceberg. We have not even dealt much about communication because of the the time limit. This thing we have not spoken about the difficult communication. Breaking bad news, breaking adverse events and incidents to the patients, in case in event of death and in event of any criticality of the patient, how do we communicate to the patients? So I know that would again be another session altogether, because we have just brushed on to what are the different types of communication, what nurses need to remember when they are communicating with the patients. So with that, I'll hand over now to have you stopped the poll is over? Yeah, most of the staffs have answered correctly. So the question one is gestures will tell us about pain. Question two is about, yes, looking annoyed and not making eye contact are non-verbal blocker. Yes, not mostly, it is yes. And which of the following is not a characteristic therapeutic communication? Giving advice. Empathy is required. Active listening is required. Mutual respect is required for therapeutic communication. And the 4 C's, that is the take-home message which you should remember, that is clear, concise, correct, and complete information to our patients is very, very important. And what are the levels of communication? Yes, therapeutic, situational, and social. Okay, I thank all of you all for participating in this poll, and I want to hand over for the, please end the poll, madam. Yeah. Okay, so I don't know why this is coming again and again. Okay, scientists have now confirmed that the human body is phasing out vocal cords due to texting and a lot of use of mobiles. But this time you need to use your mobile phones for our quiz time with Miss Pearl. This is not going ahead. So I hand over to you for this quiz session, and looking forward.
Right. So I would sort of request everybody. Is this seen now?
Yes.
Okay. So if everybody can log on to menti.com.
Can we also do that?
Oh yeah, of course you can.
So everyone, please log on to menti.com. Please put in
Take your mobiles.
Can you please
go to
put
Google,
on
say
the
menti.com.
proper spelling, Pearl, in the chat box, please?
MENTI, menti.com. Let me just blow up the screen.
Yes, menti.com. Please log on to to this website.
One minute, I don't know how to stop this hanging.
I think the question has already appeared.
Already appeared. Just put the code 98083744.
7808.
Oh, sir is also participating.
Yeah, it is 7-8.
So exciting prizes for the participants, all the way coming from UK for
Ma'am,
Christmas.
can you please repeat the code?
It's written on the screen. Can you see the screen? 7808
There on the screen.
3744. I hope everybody has logged in. Maybe we can. I'll wait for a few seconds before I move on to the next slide.
No, don't wait. I think a lot of time has been given on this first question.
Well, it's not happening.
Right, let's go on to the. All right.
Code is
I think we have
mentioned on
24
the
players
screen.
as of now. Let's move on to the next question then. Whoops. Sorry, guys, 1 minute. Yeah.